Now, coming to our first section, that is the neuropathies, we'll be briefly going through the peripheral neuropathies. What are peripheral nerves? As you know, that there are actually corticospinal tract which starts right from the brain, it descends down through the spinal cord, eventually synapses in the spinal cord, and then from the spinal cord exits the nerves. Now, these peripheral nerves are actually those nerves which are actually supplying the specific group of muscles. They are the ones which are actually carrying the sensation from the skin areas and back to the spinal cord, and actually all this to and fro movement of the neurons helps us to detect different stimuli and perform different functions. So in this section we'll be going through briefly their pathology, what we're briefly going through chronic axonal degeneration, and what are the demyelinating neuropathies. So, as you know, that actually the peripheral nerves, classical example is radial nerve. It contains fibers of both the motor fibers as well, which are supplying different group of muscles, especially the extensor compartment of the forearm and the hand. Then it also contains sensory supply fibers as well. It's also briefly supplying the superior lateral border of the forearm. Therefore, if it gets cut, or for example, it's iatrogenically damaged, or it gets damaged after fracture of femur or humerus, then what actually happens is then all these usually is fibers are lost. That means that in case of peripheral nerves, they are always associated motor and sensory deficit as well. And as they also contain the autonomic functions as well, and the fibers which have actually postganglionic fibers of the autonomic ganglia, which contains the sympathetic and parasympathetic fibers as well. So on the whole, if they get damaged, both all the motor, sensory, and autonomic fibers and function is lost. It could be simple, a short segment. For example, if there was a hematoma at some area, it's causing the compression of the nerve. There could be a transient loss of nerve function, which may recover eventually completely. But sometimes the whole nerve could be damaged because it's degenerated, it's can lead to some kind of a disease, or actually the whole it has evolves from its roots, resulting in complete paralysis of all the muscles. There are actually 100 different types of neuropathies, but to briefly classify them into different groups, we usually classify them in such a way that it's called as radiculopathy. That is the nerve roots which are actually coming out of the spine are briefly, if they are affected, that is called as radiculopathy, which involves usually the nerve roots. Usually it may be caused by the vertebral trauma, hernia, or bony spurs. Usually the root infection, especially the herpes zoster infection, it actually affects this area of the, especially the posterior superior ganglion of the nerve fibers. Then it can be divided into plexopathy, which is actually, for example, due to tract trauma to the peripheral nerve. It could be by compression of local tumors, for example, Pancoast tumors, especially the tumors of the upper lobe of the lung. They cause local compression of the brachial plexus, leading to brachioplexopathy. It could be due to thoracic outlet syndrome, because in which there is an associated extracervical rib, which once compresses the specific nerve roots, especially the ulnar nerve, which is exiting out of the brachial plexus, resulting in classical symptoms relating to ulnar nerve neuropathy or thoracic outlet syndrome. Then it could be distal neuropathy, that is, it's actually affecting those peripheral nerves which are actually well far away from the any plexus or even the vertebral canal. This could be neurons in the distinct peripheral nerves. This could be mononeuropathy. For example, there was associated shaft of humerus fracture, this resulting in the damage to the radial nerve. This could be single nerve involved, or it could be multiple. If it's single, it's called as mononeuropathy. If it's multiple nerves that are involved, for example, associated elbow dislocation, or was if this is associated with a specific injury, then there could be multiple nerves involved. Then it can be multiple neuropathy, especially, or it could be polyneuropathy if the whole of the all those nerves which are actually supplying the segment distal to that are involved. Classical example is systemic dysfunction due to diabetes mellitus, in which there is a classical gloves and stocking type of a neuropathy, in which the patient is unable to feel initially the most distal parts, that is initially the fingers and the palm becomes numb. Gradually, this neuropathy progresses from fingers upwards towards the shoulder girdle as if we are wearing the gloves. And then similarly, initially the toes and the forefoot becomes numb and there are neuropathy of associated problems. Then gradually it extends above till the ankle and then towards the knee. This is classically termed as glove and stocking type of a neuropathy in diabetes mellitus. So what actually causes this neuropathy? There are three basic types. What is actually the main mechanism due to which happens? This is acute interruption of axonal continuity. For example, if there was a fracture of humerus, shaft of humerus, this resulted in a radial nerve injury due to this trauma. There was a laceration of the axon and there is actually cutting of the axonal continuity. The next could be axonal degeneration. For example, there was some kind of a trauma was there, but it was not kind of a cutting trauma, rather it was a compression injury, which resulted in the degeneration of the axon, which was actually was the part of the neuron. The other could be a systemic disease. The problem is not particular to the nerves, but it is actually somewhere else. But this results in a demyelination. This demyelination would mean there is a degeneration of a axonal sheath around it. This myelin sheath was degenerated. These nerves actually lose a lot of function because actually their speed is lost. This results in decrease in delayed nerve conduction, which is very much visible on these peripheral nerves if they get demyelinated. Now coming to the what is acute axonal interruption. This is classical after nerve division. For example, was if there's an iatrogenic injury or if there's a classical laceration which was involving and resulting in cutting of the nerve. This results in immediate loss of motor and sensory functions. Usually the next thing is axonal degeneration, which could be due to crushing of the distal axonal segment, especially in case of a massive trauma, which may be not only causing a classical compression and shear injury of the soft tissues, which may also cause the compression and shear injury of the nerves, resulting into a loss of all the functions of the nerve, which include both the motor, sensory, and the autonomic. This may be detectable by nerve conduction studies, which are usually and nerve conduction studies and EMGs are done at 3 months to assess whether this in a injury which was happened, which has happened to the nerve, was actually transient, as the nerve function recovering, or is it is a permanent damage. Then depending upon what kind of injury it was and what plan needs to be done, whether we need to go for some kind of nerve grafting or we may need to eventually go for tendon transfer after 6 months or 6 to 9 months of interval post trauma. Usually axonal generation is very slow. At times it's almost 1 mm per day, and until unless these ends are not opposed properly, usually the regeneration of the axons do not occur until unless they are properly sutured together. Coming to the chronic axonal degeneration is called as, usually this happens with the large fibers disorder. There could be a small fibers disorders. Those large fibers are actually those fibers which are not only increase in diameter, but they are actually large conducting fibers, especially alpha fibers, which they conduct at a high speed, especially involving different reflexes. So they affect the sensory and motor neurons. Stocking glove type of numbness is seen in them. Usually altered reflexes and ataxia and weakness is always associated with them. There is reduction in CMAP, snap responses proportions to the loss of peripheral nerve, and EMG usually shows a denervation changes in the distal muscle, because once the foot end plates of the nerve is lost, eventually the muscle would atrophy and so will eventually show the denervation changes. If it's a small fiber neuropathy, those involving C-type or B-type fibers in which it's a slow conducting, this usually means fibers mainly involved in autonomic reflexes usually. So this results in hypotension, arrhythmias, there is reduced lymph perfusion, ischemia, and usually tests not sensitive to distinguish such as disturbances. For example, if a patient who is diabetic and complain, they may be associated peripheral neuropathy with autonomic neuropathy as well. So sometimes very difficult to diagnose whether this is actually the problem with those fibers which are carrying the sensations, or it is a problem with those fibers which are actually providing a vasomotor reflexes to the vessels, so that they can either constrict or dilate, provided what kind of response is needed to the external stimuli. Coming to the demyelinating neuropathies, as we know that actually the neurons are covered from axons, and these axons are from the myelin sheath. They're associated nodes of Ranvier. For example, these are the areas in which there is this myelin sheath is actually absent. And normally, the impulse which actually jumps from nodes to node, usually called as saltatory conduction. If these nodes of Ranvier get denervated or they're lost, or for example there's a loss of myelin sheath, this conduction velocity would be affected, and the impulse will not be able to jump from one node to another node, resulting in kind of a decreased nerve function. So demyelination means actually the loss of myelin sheath. Initially, in nerve entrapment syndromes, especially in soft tissue trauma, if there was a massive soft tissue crush and shear forces which have resulted in shearing kind of injury, this is actually, it's just like that first the nerve is crushed and sheared across. So post injury status that is associated with demyelination of the neurons. It's actually slows down the conduction and may be resulting in a complete nerve block, because now the myelin is lost and this nerve impulse cannot actually jump from one node to another node of Ranvier. Therefore, it actually slows down the conduction. May be associated with sensory and motor dysfunction. Sometimes it's reversible. Sometimes the injury could be so severe that it may be resulting in a complete loss of nerve function. Exception is GBS. In case of a GBS, what happens is, although it's a kind of a disease which, as there's insidious onset, it's can lead to viral infection, but it actually, the nerve shows picture of as if it has a traumatized nerve and it has got crushed under due to some trauma. There is associated, sometimes there can be associated combined axonal degeneration and demyelination as well, and it may be very difficult to distinguish whether it is demyelination or degeneration of the axons, because it may result in complete loss of the nerve function. So what are the clinical features? If it's mononeuropathy, depending upon if it is the sensory nerve, it's only going to affect, for example, if lateral antebrachial cutaneous nerve of the forearm is affected, as it only contains the sensory fiber. So if that is affected, this will only result in partial sensory loss of the anterolateral aspect of the forearm. But if it, for example, radial nerve is affected, even if it's a mononeuropathy, but as it contains motor and sensory fibers as well, so this would result in both the motor and sensory function. If it's polyneuropathy, classical example is diabetes, because if it's affecting almost all sorts of nerve, is small or large fibers. Therefore, there's not only associated sensory loss, there's also associated motor loss as well as autonomic loss. So the classical example of glove starting distribution is in case of diabetes mellitus. Other examples, if for example in case of carpal tunnel syndrome, when one's median nerve is compressed, it may present with paresthesia, burning and shooting pains, and it may be in with tarsal tunnel, there may be associated with these kind of similar pains going through the plantar fascia as well. Other example, weakness of the muscles, because these muscles show degeneration and denervation, may be associated with imbalance. There may be a deformity such as claw hand or cavus foot. This may be due to, because once the muscles undergo degeneration, they usually resulting in a fibrosis. And for example, intrinsic muscle of the foot, if get fibrosed, those muscles which are normally working, in case they will pull during the normal movement and gait cycle, this may result in upward pull of the midfoot, resulting in kind of a cavus deformity, which actually kind of happens in Charcot-Marie-Tooth disease, in which peroneus brevis and tibialis anteriors are weak. They cannot do it properly, resulting is peroneus longus and tibialis posterior pull it in such a way, resulting in a cavus deformity. Other includes skin changes, includes trophic skin changes. There may be associated with ataxia and joint instability, because sensation is lost, proprioception of the joint movement is probably not, the proper feedback is not going back to the brain. They may associate with abnormal movements as well. And lastly, it includes nerve injuries which may resulting in entrapment syndrome. Classical example is if ulnar nerve gets entrapped around the medial epicondyle, this may result in ulnar nerve injury, or in the case of that tarsal tunnel syndrome, in which the nerve gets caught in the tarsal tunnel, leading to tarsal tunnel syndromes. In this, we have gone through the pathology, how the nerves can be damaged. There could be an acute damage from the trauma, which in which the whole axon gets cut, or they may be crushed due to certain pressures. For it may be due to trauma, or maybe due to, for example, a collection of hematoma can compress the nerve, leading to some kind of axonal degeneration, or there may be so severe injuries which eventually may be associated with demyelination as well. We have also gone through that there are certain systemic diseases in which there is actually demyelination of the nerves, and this demyelination actually results in decreased nerve function, and this may be resulting in complete nerve loss as well. Thank you very much. Keep watching sqadia.com.